For our Zoom people, I want to flag some things. We do have closed captioning available. So if you go to the bottom of your screen and see a CC, that will allow you to see the captions, just to make sure everything is accessible for you guys. Also for Zoom, there's a Q&A, 2 speech bubbles you should see at the bottom. And that's where you guys are welcome to put in your questions for the panelists. And then also the speech bubble in the chat where you guys are invited to start sharing your introductions and sharing where you're watching from, where you're tuning in from in the state. And on Facebook, you guys are welcome to use the chat to do intros as well, and also share your questions that we can bring to the panel. Thank you in advance for the patience with tech issues. We know it happens, and feel free to let us know in the chat, and we'll make sure to address it. So good to see you guys. My name is Rebecca Johnson. I use she and her pronouns, and I'm the Springfield organizer with Missouri Healthcare for All. So feel free to give out your introductions. It's good to see you. And I'm going to pass it over to my coworker, KJ.
Welcome, everybody. Thank you so much for joining us tonight. As Rebecca said, my name is KJ McDonald. My pronouns are she, her, hers. And I'm the Joplin organizer for Missouri Healthcare for All. Tonight's panel is also co-hosted by Joplin for Justice, which is a local group from Joplin that organizes around racial justice. And so we thank them for co-hosting with us tonight and for helping us to organize this event, and also sharing it out on Facebook with all of their members. So for those who are maybe a little less familiar with Missouri Healthcare for All, we are a statewide nonprofit grassroots organization working to make quality healthcare affordable and accessible for all Missourians, no matter where they live, the money they make, or who they are. And I think that we're all pretty clear about the fact that cost is a huge barrier to healthcare. But I think maybe something that we don't talk about as often is about racism as a barrier. Systemic racism has deep roots in this country, and it is enshrined in all of our systems and institutions. And the reality of systemic racism's impact on healthcare as it applies to Black, Indigenous, and other communities of color was brought to the forefront of our social consciousness as we saw the disproportionate impact that COVID-19 had on those communities over this past year. According to the Journal of the American Medical Association, infection rates are more than 3 times higher and death rates 6 times higher in predominantly Black counties compared with to predominantly white counties. In California, Latinx populations represent 70% of all COVID-19 deaths in the group of people aged 18 to 49, despite making up just 43% of that population. And Indigenous people are the most likely of all races to be hospitalized for COVID-19. And even now, as vaccinations are rolling out, we're already seeing the impact that systemic racism has on those who get the vaccine first. We don't have the PowerPoint pulled up, but looking at a map of Chicago, you can see highlighted the areas that are most impacted by COVID versus where the vaccine has been distributed, and they are polar opposites. So whether it's purposeful or accidental, these types of disparities continue, and they disparage Black, Indigenous, and communities of color and impact their health and health outcomes. So if we want to fight for a better healthcare system, we have to prioritize the most marginalized people in that fight. And in order for us to create effective solutions to solve these health disparities, we first have to educate ourselves on the fact that they exist and how we got here. And that is why we're here tonight, to hear from this panel of experts about their experiences with systemic racism in our healthcare system, to talk about the centuries of systemic oppression that got us here and how we can address it head on. In short, we, especially white people, are here to listen so that we can be aware of the conditions that cause these disparities and then go and do the work to change them. First, I want to introduce Dola Flake. Along with her many other qualifications, Dola is one of the founders of Joplin for Justice, which, as I mentioned, is a local organizing group for racial justice and equity. And she has connected us to a couple of our panelists tonight and done a great amount of work to help get this event off the ground. Dola, would you mind introducing yourself?
I think you're muted.
You're muted, sweetie. Thank you. My name is Dola Michelle, and as KJ mentioned, I am one of the co-founders for Joplin for Justice, which is a community effort that really just addresses issues related to justice like race and other equity issues. I also act as the diversity and transition coordinator for Missouri State University and do diversity consulting and training throughout the Southwest Missouri area. Glad to be here.
Awesome. And then we'll just have our other panelists introduce themselves. Kimberly, if you'd like to start, Dr. Kimberly Martin.
Sure, no problem. Good evening, everyone. My name is Dr. Kimberly Martin. I am the Director of Multicultural Programs at Missouri State University. My pronouns are she, her, hers. I am recently moved here from Michigan. I just celebrated my 1-year anniversary in Springfield, Missouri. But I have worked at a variety of institutions and can say that systemic racism has been a part of them all. So I'm looking forward to being part of this discussion tonight.
Thank you. And Anthony Franklin, would you like to introduce yourself?
Yes. Hello, everyone. My name is Anthony Franklin. I'm a mental health clinician at the Missouri State University Counseling Center. I'm originally from Chicagoland area, and I moved here for my master's program and continue my doctorate here.
Awesome. Thank you so much. And last, Marshall, would you like to introduce yourselves to the panel?
Hi, my name is Nurse Marshall. I'm an RN. I just celebrated 26 years of being a nurse this month, and I've worked correction. I've been a correctional nurse in a hospital, traveling nurse, you name it, I've been there. And it's nice to be invited to be on the panel.
Wonderful. Well, thanks again so much to all of our panelists for being here and sharing your time with us tonight. Rebecca and I will be facilitating a panel discussion where essentially we'll just be popping some questions over to you all, and whoever feels inclined to respond to the question, to share your experience and your knowledge, please do. We don't have to answer all the questions, and not every single person has to answer every question. So I really want this to be more of a discussion and to really follow the lead of our panelists as they are the experts here tonight. So Rebecca, do you want to go ahead and kick us off?
So the first question that I want to pose to you guys is, can you speak to how the COVID-19 pandemic has disproportionately impacted Black, Indigenous, and other people of color and those communities? If anyone wants to start, feel free to jump in.
First, there has been lack of testing opportunities. There was minimum when COVID first came out. When testing came available, it was very limited, or no one heard about it. And the older generation, they're not technology. So if you don't have like an iPhone or internet or computer, you just kind of don't know about it.
I'll speak to also just the dynamic of being in a pandemic at the same time that we're also experiencing racial tensions and political tensions as well. I can say that I work with a lot of students from diverse backgrounds, mostly students of color, and the increase in need for counseling services, the impact on mental health, understanding that not only are people of color experiencing a pandemic, that they're being impacted by high numbers, but they are also significantly impacted by other things that are happening right now in our nation. And so I want to say that mental health has been significantly impacted in communities of color.
I'll add too, from a high ed standpoint, that I know when we shut down in March, we were scrambling to get our lower income, first generation kids hotspots, and computers and things like that, because I think the assumption is, as Dola just said, that they have access, Nurse Marshall just said, that they have access to technology when they may not, or they're in a household where they have to share that technology, which means they can't be the only one using it at a time. So we were really, it took us, we really dove in for 2 solid weeks to try to make sure that we connected with those folks and provided hotspots and computers and everything. But just the fact that we didn't think about it beforehand, like we didn't understand that closing down would have this effect on some folks, just says a lot about the system, actually.
To kind of touch base on the technology piece and counseling, that was something that is a barrier, especially for students that don't really have those types of resources as far as having internet connection and the virtual capability to meet online. So it created even further barrier, which is already quite enormous within the Black community to begin with, as far as the mental health stigma. So it kind of created another barrier for our students.
Yeah, thank you so much for speaking to all those various aspects of the impact that the COVID-19 pandemic has had on Black and Indigenous and other communities of color. To sort of continue on the realm of institutions and systemic racism, I want to know, can someone speak to the long history of systemic racism and how that intersects with all of these issues around access to quality care for BIPOC people?
I'll speak just to it a little bit. So in our nation, we have a long history of poor treatment or unequal treatment to people of color, and a lot of negative messaging that anyone who's grown up in America has received about people of color. And so what that has done is created implicit biases, and it causes healthcare workers to respond differently to people who are of color. We have the data to support that this is happening. An example of that is the difference that we see in prescribing pain medication, that people of color are less likely to receive the pain medication that they need. And part of that is related to implicit biases and ideas that the people of color are not being honest about their pain. So the implicit bias piece and how healthcare workers, whether intentionally and usually not intentionally or not, do tend to respond differently to people of color. And so I think that that's having a huge impact. Another example I would give is, as a medical social worker, I tend to see people of color being flagged more frequently for social issues that would require some sort of hotline or some sort of intervention. And so I do think that we have to be aware of standardized processes and sticking to those, so that we're cautious of not treating one group of people different than others.
I'll kind of tag team along with Dola here, because I used to work at a medical school. So I got a very close inside look at how we train physicians and expectations and things like that. And first and foremost, just on the physician side, there are so many barriers to that people of color, it's almost impossible to surpass. And even then, even though medical schools now are saying more and more that they use a holistic process, they still look heavily on scores and things of that nature, which is another filter for students of color. So the first issue is we're not training enough Black physicians or Latino physicians or whatever. That leads to a bunch of white people mostly making these diagnoses and making assumptions and teaching that through the way that you were trained. Now, one of the things we tried to do, and I hope most medical schools do or will do, is have a class. And it was just a 1 credit thing they had to come to once a month, but we tried to teach that. Like, for example, with the biases, not every person is drug seeking that is of color. No Black people cannot take more pain, which is actually a belief that they have. So we used to try to talk about things like you're not, the kind of patients that you will see will not be from your neighborhood. The kind of people you're going to be treating are not going to be necessarily from your class. So you have to not be so quick to flag them as uncooperative or non-compliant, when perhaps the thing that is keeping them from being compliant is lack of money, lack of transportation to keep the appointments, and things of that nature. So it goes back to even how we train physicians, and the fact that education, higher education as a whole, was started by white Christian men. That's who it was for in the beginning. So, and we're still living with a lot of those structures and beliefs, even though we have come a long way from that to who can attend college.
I'll just add one more piece to that, of how long-term systemic racism is impacting, especially, including Southwest Missouri. So we have a culture that struggles with acknowledging racism and addressing it. So what we see is we bring hundreds and hundreds of doctors every year through Southwest Missouri with our medical schools and our hospitals, doctors of color that would help to close that disparity gap for the treatment, for the care provided to people of color. But those doctors have a hard time staying in this area because it's not inclusive. They can't see raising their families in this area. And so we lose high quality doctors. We increase our turnover rate, and we lose money as hospitals and in our healthcare systems because we simply cannot retain people of color at the rate that is going to improve our quality of care provided to people of color.
Yeah, absolutely. Yeah, I think that really speaks to like the locality like that we are in. Is that like what folks experience is not what they want their kids and their families to experience. And kind of going on that note, I kind of want to ask if you guys would be able to share any like examples of ways you've experienced or witnessed like racism within the healthcare system, either in like a personal manner or in a professional manner.
I have as a nurse, when you go to take care of your patient, they're really rude or can be very disrespectful and don't want you to take care of them or touch you. I've even been called names, but the way I look at it, it's just ignorance. I mean, I'm a nurse. It doesn't matter. I'm going to save your life based on the color of my skin. But people don't look at it that way.
I will speak to, I wanted to kind of talk to an experience and then also give an example. So I've had the pleasure of having a dual role in the healthcare system that I work for, and I've been able to do my diversity work as well. And so I was able to train several departments, including top leadership within our facilities. And it was very obvious that there was still not an acceptance that racism was happening and was an issue. There was a lack of knowledge and understanding about the need to be intentional addressing it. And so for me, it was, and there were comments made directly to me after giving my trainings, like, slavery was a long time ago. We need to stop focusing on the negative. And just there's no awareness of how our history is impacting today. So I do want to give a quick example of it's something that may seem small, but had a huge impact on the patient. And so I was in the room as a support to the patient, not in my role as social worker. And they determined that she had this person had fibroids, and they are okay with me sharing their story and not their name, but this person had fibroids, and the ER doctor comes in and proceeds to tell her that she needs to have a hysterectomy. Well, that information needs to come from a specialty care provider. The role of an ER doctor is to make sure that there is no life-threatening issues and refer them on to a different provider. And so when I left there, this person was really distraught, never having children and being very young, now feeling like they were no longer able to have children. And it was just a very inappropriate statement by the doctor. So I left wondering, if that patient were not a Black gay woman, would that doctor have been more sensitive if she looked like a mother or a daughter or a girlfriend of that doctor, that white doctor? Would that doctor have been more sensitive to her when they delivered their recommendations? So I know that seems really small, but that's just an example of that doctor probably was doing his best to provide good care, but sometimes we just aren't as culturally sensitive or aware when we deal with people who are different than themselves or that we have been raised to have implicit bias towards.
I'll share a personal story that it's not really even long, and so I think Dola mentioned it. I was actually had to prove at one point I have back problems ongoing. That just to tell them, all right, look, I'm not drug seeking, and these other things that you're giving me are not working, so I need something. And so I eventually got them, but we had to go through like 2 iterations of some other stuff. And I don't think necessarily that would have happened to a white person of any gender. So it's just that like the bias that you have that either you're not really in pain or you can take more pain, of being the only person around that may or may not have a physician, nurse, whatever that looks like them. Or being scared, and especially if there's a language barrier. That's another big thing. Many hospitals are not investing in either translators or some kind of translation software. Where I come from in Michigan, there's one hospital and it has an acronym like Oscar or something. I can't remember what it stands for, but it translates like 100 or some odd languages. Because in the Detroit area where I'm from, we have lots of Eastern Indians, we have lots of Chaldeans, and so there is a huge language barrier sometimes between patient and doctor. And we also have patient advocates. So I do think, but not everybody's doing that. So that's where the disparities comes.
Thank you so much for sharing those experiences. I know that sharing those personal experiences can be painful. And so I really appreciate you both really opening up and sharing about some of those painful experiences so that we can be more aware of the ways that implicit bias manifests in our healthcare system. I've got a question from one of our attendees. Nurse Marshall, in your long career, have you seen an increase in diversity training for nursing or nursing students or hospitals? Now, has the ANA addressed systemic racism and how that impacts communities of color?
That is one thing that's lacking in this area is diversity. I haven't been to a diversity training since 1999. That's pretty sad. We very much lack diversity training, and I always speak about it. There needs to be diversity training, especially in this area. And what was the second question? I'm sorry.
Has the ANA addressed systemic racism and how it impacts communities of color?
That's another no.
And I wanted to toss that over to Anthony, if you don't mind, to maybe speak about it from the mental health perspective, and maybe a little bit about, how are they doing when it comes to training and diversity for mental health practitioners?
Mm-hmm. Yes. So it's actually built within our programs. I know, especially for mine, you have to go through diversity classes that kind of exposes students to different types of cultures and being able to interact with different clients that they may be exposed to. So now I know that that's something that they built within the program itself. It's more so about their exposure to those types of clients. I think a lot of clinicians may not even have that exposure to even be able to have that understanding of how to actually work with those types of clients if they only read it in a book versus actually having that person-to-person experience.
Yeah.
Jay, if I could
Go ahead, Dola.
I just wanted to real quick speak to, I do see in my healthcare system an intentional effort to develop committees and implement training, but it is still on such a superficial level that it's not making the impact we need. We need to remember that these are deeply ingrained biases, that it's not a one and done. We need to address not only the training piece that's ongoing, but we also need to look at our policies and our procedures, because a lot of the times the disparities are really embedded in the written ways that we do things. It's not always an individual, but that's when we see it at that systemic level. And so oftentimes I just want to also point out that there is a lack of trust in our nation for people of color, not just in the healthcare system, but across all systems. And because of poor treatment and throughout history of people of color, that lack of trust often goes both ways. And so when you hear our stories about the treatment in healthcare systems, and you're wondering why a doctor or a provider might make a decision, whether intentionally or not, that is different, it's important to remember that we have plenty of data to show that people of color will be perceived more negatively, they will be trusted less often, and they will be perceived as if their intentions are not good. And so just keep that in mind as we discuss our personal experiences.
Thank you. Thank you for saying that, because I think sometimes it does get lost in the what do we do next kind of stage, and sometimes stays there. And also like in a system that like uplifts like whiteness at every turn, especially for white folks, we don't have to think about if we're going to be trustworthy. Trust is always assumed. So thank you. Thank you for saying that. I kind of want to delve a little bit into like the impact a bit further about like how does this impact like the health and well-being of BIPOC individuals? Like we've heard some of the things from what KJ shared of like the numbers show how hard COVID is hitting like people of color. But are there other ways that you guys would want to highlight just that affect the health and well-being of Black and Brown folks?
I feel like one of the things is the lack of explanation. Like when you go to a physician, they talk to you in medical terms. Sometimes, a lot of times, the everyday people are not going to understand. If you don't work in medical, you're not going to understand those terms. I've told patients, I tell my family, I tell my neighbors, pastor, everyone. Once they get their spill, it's okay to ask them, now, can you explain that so I can understand it? Or can you speak English to me? It's okay to tell them I don't understand. But I always encourage, you have to ask questions. If you don't understand, ask.
I would just add that economically, what we see is that people of color tend to be more likely to be experiencing some level of poverty. And so when you think about the people who are already struggling and then an economic crisis happen, like job loss or medical bills related to COVID, things like children being out of school and requiring to pay for childcare, it really hits hardest our most marginalized populations. And so people of color are experiencing that at high rates. We are all impacted by it, but we are seeing more economic impact as well. So that's an important piece.
I'll also add that another reason why, the disparity, there's such disparity, for example, we all know, as Dola just said, that the numbers of positive cases and deaths are highest among Blacks and Latinos. And there's so many reasons for that have to do with discrimination and bias in the healthcare system. One of those, well, this isn't that biased, but one of those is the fact that a lot of racial and ethnic minority folks were disproportionately represented in essential work settings. So they never shut down. They never, took time off. In some cases, were forced to work when they were sick at the beginning of this. So there's more of them getting it, and there's less access to the healthcare and utilization. Nurse Marshall said, if you look at I think maybe KJ said, if you look at Chicago and the areas where it's distributed versus the areas where there's the most cases, it's night and day. So still we are, and whether that be on purpose or just because, quite frankly, sometimes white folks don't really have to think that deep about it. We'll just do it over here. They don't have to go through the things that people of color have to think about, several steps of everything. Like, how are we going to get to this place? How are we going to get a shot? And even now with the distribution of the vaccine, it's the same thing. The people who probably need it most, like essential workers and then the prisons, I'm almost sure are not getting any or enough. And so what people don't realize is that affects us too, because these people are going to interact with folks, and those folks are going to come out of those places and be carriers. So, and if you're poor or have a huge economic gap between you and the next person, it affects the way, can you pay for childcare? What happens if you do get sick? Who's going to pay for that? Who's going to watch the kids? I mean, there's so many different things that people of color have to think about. And also, and on top of just the pandemic. And so that's where a lot of stress comes in for them. And as Anthony said, the mental health at Missouri State right now, they're booked up. They can't keep up with the number of students that want to see counselors. And that's because, COVID is enough to stress you out, but racial stress on top of that can be devastating. And you're trying to still be a student and be in school and progress on. So there's a lot.
Yeah, I think it's definitely one of those things that makes it's just hard to see with white privilege. We sort of have these lenses on, and we're not thinking about all the intersections of the ways that practices like redlining and segregation in schools and all these kinds of practices that seem like they happened so long ago compound over time to create conditions that make it really hard for marginalized communities to really, frankly, catch up with and be able to access what we all deserve. I've got another question that was submitted by one of our attendees from Aaron. It says, first, I want to thank you all for taking the time to answer these questions. My question is about Medicaid expansion and its recent passage in August of 2020. I'm wondering if there are some changes you're looking forward to once it is fully implemented, and do you think this will help our BIPOC communities in rural areas of Missouri? I don't know if somebody wants to take that on.
I mean, increasing coverage means increasing access. If you don't have to, what will happen with Medicaid expansion is we will see a lot of people who maybe work part-time or didn't qualify for other type of government insurance. We'll see those covered. What we have in Missouri is a huge gap of coverage. And so if we can close that, then we help overall, but we will especially see impact for people who are lower income. As we know, people of color tend to take up a large percentage of that in our disproportionate percentage of people living in poverty. And so expanding Medicaid, increasing access is so important. As we increase access, we put people in situations that they increase with their education, they take that back to their families, and there's just this domino effect that's beautiful.
Thank you. I'm going to pop to a question that was actually put in the chat. It's from Nohemi. Please forgive me for mispronouncing if I did. Why are the COVID vaccination rates so low for Black and Brown patients? They say they are a Latino provider. They're educating patients, and they're interested in knowing kind of more of what the systemic barriers are there.
I can speak to that a little bit from two perspectives. One, the mistrust, and then two, the distribution method. So the medical community has a history of distrust with Black people in particular, because we have been used unwittingly as guinea pigs in experiments, one of the most famous being the Tuskegee Experiment. For those of you on the call that don't know about it, Google it. It's Black History Month. But basically, it was a situation where they were forced to participate. They were told they were being treated for something, and they weren't being treated. What was happening was they were being monitored to see how the disease progressed. And there's a story of Henrietta Lacks, another person whose cells were used and are still used today in many cures and vaccines. She had no idea at the time that that's what was going on either. So the first issue is mistrust. And with the COVID vaccination, I have seen, thank goodness, a lot of famous Black folks, a lot of famous folks like the president and the vice president saying, please, there's a trust. They've even had, I heard a Black female doctor was involved in the development of the final version of the vaccine. She was on, Facebook and various news programs. So there's a lot of education that has to go along, and a lot of trauma associated with that in the past. I have friends that flat out say, I'm not taking it until, like a million people, 11,000 or whatever they said, till we know what it's doing. I've already had my first shot. So I try to educate, those around me, my students. We had some discussions last night. I'm just letting you know I took it, no side effects, nothing's happening. Doesn't mean you won't have any, but it's a good thing. So the first issue is the mistrust. The second issue, obviously, is the distribution. We've seen over and over again that, for example, people were saying, why are the government officials getting it first? Because they're not essential workers and, all that kind of thing. So it's not being evenly distributed. And then even in some cases where it is, in rural communities where you have only one hospital and you have to figure out how to get there, that is a huge barrier to the distribution. And I don't even know, and someone else can speak to this because I don't know how the vaccine works, but I don't know if you don't have insurance, can you still get it? So that could be another barrier. So to speak to your question, it's basically the mistrust and then the access, I think.
Anybody else have anything to add on the distribution of vaccines to communities of color? All right, I'm going to move on to a question from Nakia, also in the chat. Due to systematic racism and a history of mistreatment of BIPOC at the hands of medical professionals, lots of folks suffer from anxiety during medical appointments. What tools are you using to help ease that anxiety and help patients advocate for themselves?
I'm not sure from a medical setting, but as far as ways to kind of be able to ease the anxiety is being able to first create that awareness of where the anxiety is manifesting from. What are these thoughts that are being triggered in that individual's mind? And once you start to create that awareness, you start to understand where the beliefs are and start to challenge those beliefs of the mistrust of the medical professionals based on those past history and the trauma that they have maybe experienced, or their parents may have experienced. So being able to find ways to challenge those beliefs so they're be able to gain some type of comfort and gain some type of positive perspective on the field itself. And then there's other coping mechanisms that you can utilize as well, just like breathing techniques and things of that nature.
I think at a systemic level, the best thing we can do is diversify our workforce within healthcare. I think that's incredibly important. This wasn't my idea. This actually came from Don in the chat, but he says, what about accompanying a person of color to a doctor's appointment as a white ally? And I think that that is brilliant. I think that not only does it bring some comfort to the patient, but it also increases accountability to the provider. And I think that it could have a significant impact on the experience within a healthcare setting.
Some systems also have, and again, bigger systems have bigger resources, but some systems have patient advocates that will go to speak to the doctor or the nurse or whatever, along with patients, to make sure that they understand what the doctor is saying, they understand what their treatment options are in the whole nine. So in lieu of that, I think his idea is wonderful, just to be an ally. And I don't know if a hospital will be receptive to a community group starting something like that and just saying, can we come in here and be patient advocates? So might be something to think about.
Something else that can make a huge impact if done on a systemic level is if we had some kind of way to recognize people who are trained specifically to address issues related to people of color, the same way that we have specialties within our licensures. If there were a way to tell that this provider has taken these extra steps to be culturally competent and culturally sensitive and has the knowledge base to be aware of the needs that this population has. So I don't know that we have something in place like that yet, but wouldn't it be wonderful if our med schools or our licensures started to provide greater requirements, but also access to the public about who has met those requirements?
Yeah, absolutely. And that kind of segues into Ruth's question. And they asked about organizations. This kind of goes into where we'll close as well. About organizations working on addressing these issues. The huge medical industry in this area clearly needs a lot of work. Who's doing it? And I think that means this work. And how can those of us who are a part of the system and clients or patients get involved?
Me personally, I took part in it was, when I started, it was disability inclusion. It then broadened to diversity and inclusion committee that my healthcare system has. And so being present and at the table when decisions are being made. But I think one of the biggest impacts is being willing to call out microaggressions and call out inappropriate behavior with your colleagues. Most of your colleagues, I would hope, have built, for people of color especially, that they have built a trusting relationship in a way that you could address an issue not in a confrontational way, but in an educational way. And so I think we have to get used to having conversations that are difficult in spaces that we are highly regulated in. And so speak up, use your voice.
And also from I don't know if I would call this necessarily a political standpoint, but we can promote things like healthcare for all or Medicare for all, and kind of deprivatize healthcare. So get involved in those kind of efforts about, how we can make this healthcare giant just not have so much control, because we all would agree that your health coverage should not be attached to any particular job, because as we have seen in the past 12 months, many people have lost their jobs. And to do that in the middle of a pandemic is just horrible. So getting involved to change rules and regulations on the state and that federal levels is another thing that you can do, or give to those candidates who support those things.
All right, I think I'm going to close us off with one last question for our panel. And, I think it's clear that like this whole thing has been built for over 400 years, and that Black and Brown folks are still feeling so much pain and trauma from interactions, especially in relation to their health. And I kind of want to ask, what do you want folks who are tuning in to walk away with from this discussion? And are there any initiatives and resources you'd really like to highlight for them?
Can start. So I hope that this conversation will be able to kind of shed some light on the impacts of mental health or health disparities. Some may not even be aware that it's even being impacted by this community. So just being able to have this platform to kind of shed some light and being able to take some of this information back with you. I will also encourage individuals to take the initiative to create that awareness for yourself and become an advocate for eradicating these disparities for these communities by being able to be an ally, being able to promote this awareness, being able to go to different programs, diversity programs, being able to be that advocate overall.
I would like to, if folks to take away that, and Dola touched on this a bit, is to please get involved with these efforts, even if you're scared, even if you think it's going to be uncomfortable, because it is. These kinds of conversations about equity and the history of systemic racism, many times we want to defer to feelings, or we don't want to hurt the other person's feelings, but people's feelings need to be heard so that we can change things. So be ready, I hope, and prepared to have difficult conversations, and not to run from them or shun yourself from them when you hear them going on, because that's where the understanding is. And just as Anthony said, many people, there may be people on this call that had no idea of the disparities in healthcare that are going on with communities of color. And right here in Missouri, which is a Native area in the past, the Osage people, I was talking to a Native person that I brought for Native American History Month, and he told me something I didn't even know. If, because they don't have, first of all, if you live on a reservation, there's only a certain kind of hospital that you can go to, blah, blah, blah. But the issue was that, and the fact that if one or two of them got it and came back, it was going to spread like wildfire. So they physically had to shut down. They weren't letting anybody in or out because they didn't want any outside folks, as it were, to come in and possibly expose them. But because they are considered a nation, they have to go through a lot of crap just to go to the hospital. So you're always learning something. That's something that I didn't know. Be ready to listen and understand and learn something new, even if you're in the majority, even if, there's nobody around, that everybody around you looks like you can still learn about what's going on outside of your area.
I would like to add that there's a lot going on with everyone right now in the world. There's a lot going on health-wise, politics, everywhere. We have to speak up when things are not right, when we see something that's going on that's not right. Don't be afraid to speak up and just become a better advocate for each other. Just be there.
What I would like people to take away from today is that systemic racism has a huge impact on all of our systems, including healthcare. And what that is resulting in is difference of treatment for different groups of people and disparities of outcomes. We have to be intentional about addressing it. I encourage people listening to first educate yourself the best that you can, and then take that education back to those close to you, then to your workplace. Go and request diversity training. Let it be known in your spaces that this is an important thing to you. And then beyond that, I think we each have to kind of stop and assess what are our individual unique skills that we bring to the table and figure out something. It doesn't matter what it is, but something to be intentional, to be part of the solution. And so I just encourage you all to dig a little bit and find a piece that you know needs addressed and you know you have the power to impact, and then go out and do that.
Amen to that. Well, thank you guys so much. I'm going to share my screen because we have a couple next steps to share with y'all. All right. Getting it there. Oh, wrong share. Wrong share. Sorry. So first off, thank you guys so much for being a part of this panel. Thank you. If you guys want to, be in touch with some of these folks, definitely please be a part of some of the initiatives that they're a part of. So I'm going to share a couple of the next step actions that we can take, and kind of like Dola said, educating ourselves, especially to my fellow white people listening. That is a really important place to start, so we can move and support Black and brown folks in the way that we really need to show up for them. So I want to move us into some next steps, because we can listen deeply, but we also need to reflect and move into action, whatever that could be. So definitely make sure to check out Joplin for Justice. Dola is a founding member of that Facebook group, and they really work on pursuing action for racial justice in Joplin. And kind of Springfield adjacent, we have the local NAACP chapter, who recently held a virtual MLK march, do local advocacy as well. And then I also want to share about MOVE Racial ID Caucuses, and this is something that may be a totally new thing. I didn't hear about it till about 2 years ago. But MOVE is Missouri Voter Organizing and Voter Engagement, and that's kind of the coalition of grassroots organizations like Missouri Healthcare for All, who do a lot of work together, on electoral campaigns like Medicaid expansion. But also with that, we also do that electoral work, as well as racial caucuses. KJ will put the link down. There are ones for BIPOC folks and ones for white folks, and I can speak to the white folks portion. It's really a place for us to dive into, intentionally understand how much white supremacy impacts the actions we take, even if we aren't aware of it. It's really a place for us where we can understand white culture and the privilege we hold, and how we can operate in less harmful ways. So definitely feel free to sign up for those. And if you have any questions about that, I'd be happy to answer or point you in the right direction. And then also we have a link to WashU. The Brown School is doing some webinars, kind of going into Black History Month, as well as MSU. We have an image there, but a link as well. And we'll send out a follow-up email with all these things. So if you missed them, no worries. But yeah, with that, I want to thank you guys so much for tuning in, and I hope that this can really be